For parents, making sure their kids are happy and healthy is one of the most important things. But how do you help kids thrive even during seriously stressful times? Today, I'm joined by Dr. Nadine Burke Harris. She's a pediatrician and the former California Surgeon General. Thank you so much for being here today.
Oh, it's my pleasure. Thank you.
To start off, what do we know about how hard things like adversity and trauma affect children?
Well, a lot of what we know comes from research from the CDC, a landmark study called the Adverse Childhood Experiences Study. And they looked at how serious stressors, things like abuse or neglect, or growing up in a household where a parent was struggling with substance dependence, or a mental health disorder, or where there was parental separation or divorce, these things can lead to prolonged activation of the body's stress response, something that doctors now call the toxic stress response. And all these stress hormones can affect the way children's brains and bodies develop. So they can increase the risk for things like asthma and diabetes and ADHD, as well as depression, suicidality. And in the long run, they can increase the risk for serious lifelong health risks like heart disease and cancer.
What can parents do to protect their kids from that toxic stress?
Well, one of the most important things that parents can do is number one, recognize that when we talk about these adverse childhood experiences, most of us have experienced them. Okay, according to the CDC, 2/3 of us have experienced at least one in 8 of us have experienced 4 or more. And so recognizing how what we've experienced could be impacting our parenting and breaking that cycle, breaking the intergenerational cycle by really doing our own self-care as parents. But in the deepest well, my book, The Deepest Well, I talk about the interventions that make a difference and can really heal kids' developing brains and bodies. Things like safe, stable, and nurturing relationships and environments, mental health interventions, exercise, and certain types of nutrition. And we know that that can reduce the risk.
I know we also know routine is really important for kids. What can parents do to help their children during times where that routine might go away, like during breaks from school or after a big move?
Yeah, so regular routines are really helpful for kids to be able to regulate themselves. So things like going to bed and waking up at the same time every day, having regular mealtime routines, all of those things help kids to be able to regulate their bodies, which is important for them, especially for kids who are struggling with self-regulation.
All right, a lot of really good information today. Thank you so much for joining us, Dr. Burke Harris.
It's my pleasure. Thank you so much.